Hello, in this video, I will be talking about whether or not sentinel lymph node biopsy, lymph node surgery, is unnecessary in 2023. So let me just describe briefly what lymph nodes are. Lymph nodes are glands, and in breast cancer, we generally talk about the ones under the arm, which is called the axilla or armpit. And we use sentinel lymph node biopsy or removal of the lymph nodes for a couple reasons. One is in people with positive lymph nodes that have cancer that's spread from the breast to the lymph nodes. We want to control the disease from growing and spreading. In people where the lymph nodes are not obviously positive, we want to help determine the stage of the cancer because that can help us with prognostication, with clinical trial eligibility. It can help us decide what particular treatments to give. So there are two things I'm going to update you on. One is actually not a new update. It relates to removal of the lymph nodes in women 70 years of age and older. So we've known since about 2016 or before that for people 70 years of age and older with a tumor that's 2 centimeters or less, where their lymph nodes are not enlarged and the tumor is positive for hormone receptors and negative for HER2, that's a lot in a mouthful there, that we can omit biopsy of the sentinel nodes. And that means the removal of the other nodes. So we're not even looking at the lymph nodes. Again, there are certain criteria because the studies have been done in women 70 and over, tumors 2 centimeters or smaller, estrogen and progesterone receptor positive and HER2 negative, sentinel lymph nodes do not need to be done. What we try to do is avoid over-treatment. What about for people under 70? Right now, the standard of care, at least in the United States, is that people under 70, regardless of these other characteristics, have a lymph node assessment. Now, this is just for invasive cancer. For ductal carcinoma in situ, no lymph node assessment or removal is needed, with rare exception. For people who are under 70 then, the standard of care is to do a lymph node assessment, helps us complete staging and decreases the chance that there are lymph nodes that are harboring cancer cells. I do want to add that there was recently a study published out of Europe and Chile that took women who had clinically negative lymph nodes and randomized half of the people to a lymph node assessment and half of the people to none, in which people who were 52 years of age up through age 68 were randomized to either having sentinel lymph nodes examined or not, randomly assigned. Now, these were all people with tumors that were less than 2 centimeters and in whom ultrasound did not show any suspicious lymph nodes. And also, one would imagine the lymph nodes were not abnormal on physical exam. When the lymph nodes were felt, they weren't enlarged or hard, and the ultrasound showed there were no abnormalities in the lymph nodes. So a few criteria here: the age criteria, the size of the tumor, less than 2 centimeters, and the lymph nodes were what we call clinically negative. So not enlarged and not abnormal on ultrasound. And people were randomly assigned to either lymph node assessment or not. There were about 700 people in each group. And remember, people had to agree to be randomized. So people who did not want to have lymph node surgery regardless, or people who wanted to have lymph node surgery regardless, would not have gone on the trial. Patients were, of course, asked to sign informed consent, so they knew that the standard was to have lymph nodes assessed. And half of the people had their lymph nodes assessed and the other half didn't. It turns out after 6 years of follow-up, there was no difference in lymph node recurrences, recurrences in the breast, metastatic recurrences, meaning in other parts of the body, or survival. So it appears from this one study that omission of lymph node assessment in people with clinically negative nodes with small tumors may not require lymph node dissection. I would like to say that we usually don't depend on just one trial to help us change practice. It's quite uncommon. We usually want more trials to confirm that finding. It's also important to know that these were people who the medical team all thought safe, were okay to omit lymph node dissection. And this study was not conducted in the United States, where there is definitely a treatment, testing, do something bias. So it's not likely to enter the mainstream in the United States. But at least from this one study, we have some interesting findings that may mean we can do less in terms of diagnostic and treatment evaluation in particular people whose tumors meet certain criteria. So it's a balance in medicine. We don't want to undertreat and we don't want to overtreat. And there are a lot of things that bias us, at least in the United States, towards treatment. It's been shown, this is interesting, that even though patients themselves don't believe a certain test is negative, they are, in the United States, are more likely to trust a doctor who recommends doing more, which I find really interesting. We have this pro-treatment bias in the United States. So just a footnote to that study and to the question of, is sentinel lymph node unnecessary in 2023? I hope this has been interesting to you. Drop a comment or a question below. We always love to hear your stories, and you're so generous in sharing with the rest of the Yerbba community your own stories. You know, we have a lot on Instagram. If you're on Instagram, follow Yerbba. We are always putting out new content and get a lot of positive feedback when we do. Thank you for watching.